How do you master Pharmacology 4, USMLE Step to CK? Imagine walking into the exam feeling confident that you can quickly recall drug facts and apply them in real patient scenarios. That's the goal when mastering pharmacology for the USMLE Step to Clinical Knowledge exam. This part of the test focuses on how drugs are used in actual clinical practice, not just memorizing facts. So, your study should mirror real-world medicine. Start by building a solid understanding of the main drug classes you'll see often. These include antibiotics for infections, medications for high blood pressure and heart failure, drugs for managing diabetes, psychotropic medicines, blood thinners, and emergency drugs used in acute situations. Know the mechanism of action for each class, their common uses, major side effects, and when they should not be used. For example, understanding why a certain antibiotic is chosen for a resistant infection, or why a specific antihypertensive might be avoided in pregnancy, is key. Use clinical vignettes and case-based questions to practice applying this knowledge. These questions often describe a patient with certain symptoms and ask you to pick the best drug or recognize side effects. This helps you connect pharmacology to actual patient care, which is what Step to CK emphasizes. Focus on high-yield topics that are frequently tested. For antibiotics, know which drugs treat which infections and how resistance patterns influence choices. For blood pressure medicines, understand their effects on blood flow and heart function. For diabetes, learn which drugs are used for different types and their risks, like hypoglycemia. For psychotropic drugs, recognize side effects such as movement disorders or serotonin syndrome. For blood thinners, understand how to monitor and reverse them if needed. Emergency drugs like epinephrine or antiarrhythmics are also important. Don't just memorize drug names and facts. Try to understand why a doctor would choose one medication over another based on patient factors like kidney function, pregnancy, or other health issues. This clinical reasoning is essential for the exam. Use reliable resources tailored for Step to CK. Question banks with clinical scenarios, review books that focus on clinical pharmacology, and flashcards for quick review are all helpful. Regular practice with these questions will reveal weak areas and reinforce your learning. Finally, integrate your pharmacology knowledge with other subjects like internal medicine, pediatrics, psychiatry, and surgery. Since pharmacology is woven into these disciplines, studying them together makes your understanding more practical and prepares you for the exam. By staying consistent, practicing case questions, and understanding the clinical context of drugs, you'll develop the skills needed to master pharmacology for the USMLE Step to CK.